We're joined now by Professor Titus Ibekwe, who is a public health professional and lecturer at the University of Abuja. Thank you so much for joining us. Well, listening to the Presidential Steering Committee, it looks like we're still left with many questions, more questions than answers. What can you tell us, fundamentally, in a way that will simplify it for not just us, but for our viewers? What exactly is the difference between this particular Omicron variant and the Delta variant? It's been described as deadly and all of that, but till now, we're not too sure there's been any fatalities. Tell us what we need to know.
Thank you very much. One thing is certain, when we talk about viruses, they are synonymous with transmutation, which is changes and evolution. So they change their forms over time, and that is exactly what we're seeing in this case. So we'll talk of the Delta variant is just a transformation in the genetic sequence of the existing coronavirus that we know. So that is one feature of every viral disease and viral illness. As they're entering from one person to the other, they're changing in their forms. Sometimes this could be to its own advantage. It may make it survive even better. Sometimes it may make it even weaker, as the case may be. And that is what scientists are concerned when you find out that you have a new variant of any viral organism that is currently causing an illness. So you want to study the features to find out, is this virus, a variant of concern or not, or is it simply a variant of interest? And what these terms mean, if it's a variant of interest, it means, yes, we're seeing some features that are interesting, that which we need to further study and look into. But when it becomes a variant of concern, that means that its rates of transmission from person to person is a lot higher than the one that has been existing before. And you go further to find out about its virulence. That is to say, it is transmitted very fast, it spreads very fast, but how deadly is this virus? And it's at that stage that WHO is now. We know that, yes, is a variant of concern, which means it can easily be transmitted. It's moving very fast. But we're not 100% sure yet how deadly this virus is. And countries that are taking precautionary measures to start shutting down their borders is in anticipation, fear of unknown, what exactly is going to happen. Nobody is 100% sure yet of the features, but what we know is that the rate of transmission of this virus is very high. And talking about South Africa, one cannot say for sure that South Africa is the origin. We know that they have one of the best viral laboratories down there. Their level of advancement when we talk of medicine is pretty high. So it helped them in testing and detecting this new variant very fast when you compare to other African countries. That's exactly what is going on right now.
That's exactly what I want to take you to. There's talk that this did not originate in South Africa, but that South Africa scientists isolated, sequenced, and then, like I just said now, isolated it first. So why is US, UK, EU banning African countries, whereas they say nothing against countries like Belgium, Israel, and some other countries where this has been found?
Yeah, if you listen to the president of South Africa, he has also been crying foul over this, because it is spreading across the globe beyond South Africa. We can see that in Belgium, is in Israel, even recently reported, few hours ago in Ontario, they've detected 2 cases there, and they're looking at even 2 more cases. So I am sure that it's also in United States. It's just over time, it will be obvious that it's everywhere. But as I said, it is like fear of unknown. Every country, as much as possible, wants to guard her own border and her own citizenry, given the potentials, that the coronavirus has and its new variants. We know of the Delta, the problem that has been associated with it. And it is being suspected that even this particular variant, which is the B11529, may even be more deadly compared to Delta. But as I said, for certain now, nobody is 100% sure. Even the information coming from Ontario, they are saying that the 2 people that they have just isolated over there, the virus from, that there's history of their traveling from Nigeria. They're coming from Nigeria to transiting to Ontario, so which also puts a query in our country here. We know that our country is an important travel destination. A lot of people come in here. So we should look more inwards and, search more, because the more you search, the more you find. It is possible that it's here with us, but until we're able to isolate this virus and we get more information from WHO, nobody for certain will be able to say that these are the features. Even from the doctor in South Africa who managed the first set of people, report coming from him.
Professor Titus Ibekwe, a public health professional and lecturer at the University of Abuja, thank you so much for being on News 9.